So hello, good morning, and welcome to everybody who's listening to the recording, and also to everyone who's here. I'm happy to start the day with this. A lot of the focus on a lot of these workshops is really what you can do to support your body, support your health. Different ways that we can nourish our bodies and care for our bodies. And fiber is a huge one. I know it's not like super. I don't know, it's not like in fashion these days, or people aren't talking a whole lot about it. And also it's such a central piece to disease prevention, but also to general health in the everyday to day kind of way. So actually more and more is coming out about disease prevention. So there's been some studies recently about fiber and prevention of breast cancer, actually, which is really fascinating. And then also, which makes a lot of sense to me because of the way that fiber actually helps us to regulate hormones. And of course, it's good for heart health because of the way that it helps to control cholesterol. It helps with blood sugar because of the way that it prevents the sugar from coming into the bloodstream too quickly. Also makes us feel a little bit fuller for longer so that we're not eating quite as much, or, if so we don't feel that kind of like need to continue eating. And then, of course, as the things that people mostly think about fiber for, it helps with constipation and actually with diarrhea as well sometimes. And then from our microbiome sort of workshops and everything, we know that it feeds our microbiome and keeps it healthy, which in the microbiome makes so many things that are really essential to our well-being and also anti-inflammatory and have anti-cancer effects. So part of what the fiber is doing is its own activity, and part of what it's doing is taking good care of our microbial communities so that they can also take care of us too. So probably the times that I prescribe fiber the most are for people who have blood sugar issues, people with constipation, people with reflux, also people with high cholesterol. It's often part of a plan for high cholesterol and constipation as well. And especially if people talk about having like incomplete bowel movements, that's definitely something where fiber comes into play. And also when people talk about having kind of variable stools, like, a lot of loose stools and kind of going back and forth between constipation and loose stools, fiber is often something that's helpful for just sort of evening things out. So fiber is really important. There's different sources say different things about how much fiber we need to have. I think that 30 grams is a great, sort of goal to have. Based on, looking at a lot of different, studies about outcomes and prevention and everything else. The other recommendations are, 14 grams per 1,000 calories. And some sources actually divide up fiber intake by, in terms of for women, they say 21 to 25 grams versus women, and 30 to 38 versus men. A lot of that is based, when they say that, when they kind of do the women versus men, a lot of that is based on average weight. And so I don't think that that's very helpful to have those two categories, just because that doesn't really, it doesn't really account for, just the fact that people come in all different sizes so I like to really think about, 30 grams is a nice round number. It also is, highly preventive for these different conditions. The average person in the United States eats about 15 grams of fiber per day, and sometimes even less, and this is where, actually too, I'll just speak to the keto diet for a little bit, is that this is a concern that I have around the keto diet, is that, sometimes people don't get enough fiber. Sometimes people take fiber supplements with that, but sometimes just, by the foods that they eat, there's often not a whole lot of fiber. And so it is really important to the gut flora to get enough fiber, because we can really shift the populations that we have growing, and sometimes it can be pretty hard to shift it back once that shift has happened. So something to keep in mind. Often too, there's something called the low FODMAP diet that gets prescribed a lot for IBS. It was never really designed to be a long-term diet, and I've seen people who have kind of by how severe their symptoms are have had to be on it long-term, but at the same time, some people have sort of taken on the low FODMAP diet, where you avoid certain sugars, fructooligosaccharides, and a lot of these different types of fermentable fibers, which means that the bacteria can eat them. And so just to kind of keep in mind that if you find that the FODMAP diet, low FODMAP diet is helpful for you, that we should sit down and talk about it and talk about how to eventually work off of that as well. So there's some people who have to be pretty careful about fiber. So people with inflammatory bowel disease, that's Crohn's and ulcerative colitis, have to be pretty careful about fiber because it can be really irritating and can make the inflammation worse. And for some people with IBS, we have to be really kind of gentle in how we introduce IBS is irritable bowel syndrome, which is kind of I call it a garbage can diagnosis because it just is basically like whenever there's things going on with the gastrointestinal tract that are not pathological. So we can't find anything that's visible or shows up on either labs or imaging. And really, a lot of times fiber is very helpful for IBS, but we have to be very gentle about how we introduce it and very, very careful about ratcheting up the amount of fiber. And then also people who can't drink a lot of water for any reason. So some people have difficulty swallowing, some people have kidney issues that mean that they can't drink a whole lot of water. We really need to meet, fiber with water, or else it's not going to go well. So a lot of the fiber, if we don't drink enough water, will actually cause pretty severe constipation, and even in extreme cases can cause bowel obstruction, because basically you have something that it kind of makes like a brick-like thing that is a little bit hard to pass through the whole gastrointestinal system. So getting enough water is really important for keeping that fiber functional and able to move through the system there. So when we think about 30 grams of fiber per day, I wanted to sort of look at this list of foods that are here. And these are some high fiber foods. You can also, there's lots of lists like this out there. Also too, I do recommend taking something like MyFitnessPal or another food tracker that tracks fiber, and just look at how many grams of fiber do I get per day? Just track your normal food intake. And if you find that it's closer to that average 15, then slowly you can work up, by some people say 4 to 5 grams a day. Sometimes for people who have sensitive stomachs, I say 4 to 5 grams every 3rd day. So you kind of slowly ratchet it up. But it's a great way to just sort of get an inventory of what, how much fiber, using these trackers is a great way to get that inventory about how much fiber you're eating, and then be able to increase from there. Food fiber sources are the best that in terms of what I've seen, better tolerated than supplemental fiber. But supplemental fiber has its time and its place, for sure. So here's some foods that are pretty high in fiber. Raspberries are a good one. I mean, so here we're talking about a cup of raspberry has a cup. Very few people eat a whole cup of raspberries at a time. It's pretty expensive to do that, and also. It's just kind of, people tend to eat smaller amounts of raspberries than that. But people do often eat a whole pear, and a whole pear has 5.5 grams roughly of fiber, which is a good source of fiber for sure. An apple has 4.5, and a lot of these, the pear and the apple, will talk about different types of fiber, and these have multiple types of fiber. A lot of foods have multiple types of fiber. What I'm bringing everybody's attention to down here, and this is kind of, I mostly wanted to include this chart so that people could kind of add up what they tend to eat in a day, and then sort of see what their number, get a rough estimate about what their number is for grams of fiber. But I want to bring your attention also to the legumes, nuts, and seeds. So, really looking at split peas and lentils. We're going to actually, this is coming up, is that we're going to have our first in-person cooking class, which will also be recorded as well. And it's going to be all about lentils. And it's taught by a dear friend of mine, Lisa Hodges, who is going to give us lots of, really interesting ways of incorporating lentils into things like, she makes lentil meatballs, and she makes lentil tofu that you can put in the air fryer, and it kind of almost comes out like French fries basically. But she has wonderful ways of preparing lentils so that we can get more of them worked into our diets. And you can see there that 1 cup of lentils has 15.5 grams of fiber. So that's an excellent source of fiber. Looking also at things like chia seeds, those, making chia seed pudding is wonderful. Even almonds and things like that have a good amount of fiber in them. So that's kind of a way to be able to sort of look at how many grams of fiber you're getting in a day, and think about ways to really increase that. One thing is, replacing any refined grains with whole grains. There's a lot of many different benefits to that, but you can see where the whole grains, like a whole wheat spaghetti, has 6 grams of fiber per cup. So that's a quite different than a regular spaghetti has, really, I think it might have no fiber at all, actually, because they really remove a lot of the fibers when they're making refined grains. So really, you can kind of see where those trade-ups are going to make make a big difference, both in terms of how satisfied you feel after a meal, but also in terms of these other outcomes, like preventing different kinds of cancer and lowering cholesterol, and probably many other things that we don't even know about yet in terms of what fiber does for us. So any questions about that, or any thoughts about incorporating more fiber? Yep, go ahead.
Yeah, one of the questions, you have raw vegetables, boiled vegetables. Is there a difference between eating them raw and eating them boiled? Is there more nutrition to boiled versus raw?
Right. There is actually. So in terms of, I'm not sure why they put boiled on there, because actually the fiber stays the same. So you still have the same amount of fiber. I want, in terms of, it is interesting that on this particular chart they put boiled. In general, you get more nutrients from things that are like roasted, or than boiled. If you keep the water and incorporate that into like a soup or something, like say you're making a soup and you're still getting all the nutrients, then you're not really losing a whole lot of nutrients that from the boiling process. But in general, eating things more roasted and things like that does maintain the nutrients more, and that is interesting in terms of the boiled. But as far as I know, that there's no real fiber lost in the boiling process, or fiber gained, really. I do find sometimes for people, like the fibers actually are a little bit easier to digest when things are boiled. Like, how if you eat broccoli, people do tend to get a little bit more gassy, and that's partially, there's like sulfur compounds, I think, that are a little bit higher. I don't know all of the differences that happen, but I do know that definitely boiled is a great way to get vegetables that to digest them a little bit. Thanks for that question. Actually, I don't know.
Go ahead. I'm sorry.
No, you go ahead.
You also are talking about spaghetti. I don't eat any of the. Is there any gluten-free thing? All right, substitutes that you could use instead?
Yep. Actually, there's a really good one. The lentil pasta is actually wonderful, and in terms of getting a lot of good fiber, that's an excellent source of fiber and extra nutrients. So they're also making a lot of garbanzo pasta these days, and that also has quite a bit of fiber in it as well. Definitely whole grains, very often can be replaced by legumes, and really legumes do have more, they have different nutrients, but I would say on average they have more nutrients, and also are a great substitute there. A lot of the gluten-free pastas, are similar in the sense to the regular pastas, in terms of they take out all the good fibers out of them. So definitely better to lean towards more of the lentil pasta. It's a good one. My family eats that a lot. Yummy. Yep. Mm-hmm. And also, too, the other thing to know about is that each of these foods does contain a slightly different fiber, and so it's great, just that, going back to that 30 vegetable 30 plant food goal from the American Gut Project. That's part of why that's so good, is because each of our bacteria in our GI tract sort of prefer different types of fibers and different types of foods, and so if we can provide them a variety of fibers, that's only going to be beneficial to our GI tract and to our gut flora. So getting a little bit of everything is better than getting a whole lot of one thing. And that's part of why the people don't do as well with a fiber supplement as they do with a food, with eating more high fiber foods, is because they're just getting a whole lot of one kind of fiber when they're eating a fiber supplement. And that can be just as disruptive to the gut flora as eating a variety of, as eating no fiber is to have just this one kind. probably not just as, that's probably an extreme statement. That it's probably not just as bad. It's just more of like a, it can still cause some imbalances if we're just eating one kind of fiber and a lot of it. So that's where fiber supplements don't do as well as the high fiber foods, but often, really to hit that 30 grams, often we do need to do a little bit of something that's either an intentional food that we eat to get more fiber, like lentils or like bran muffins, or, just sort of working something that's a high fiber food in really consistently, just to make sure we're hitting that 30 grams. And also for some people, that means a fiber supplement is helpful. So, and then there's different kinds of fiber. So the two big categories are soluble and insoluble fiber. And they actually have kind of, in terms of bowel motility, they have slightly different opposite effects. So soluble fiber kind of tends to slow things down a little bit. That's, it dissolves in water. So it kind of creates this like gel-like substance. And it helps to regulate blood sugar and cholesterol. And the things, nuts, a lot of, so what you'll see is that a lot of these are on both the soluble and insoluble fiber lists, and that's partially because a lot of plant foods contain both soluble and insoluble fiber at the same time. So nuts, beans, apples, blueberries, there they are again. They always they make their little entrance into everything. And oats are also a really good source of soluble fiber, which is why we know that oats decrease cholesterol. And so, for these, I do use a lot of soluble fiber for people who tend towards towards diarrhea, actually. So kind of like eating oatmeal is really great to do when you're having a lot of digestive upset and diarrhea. And also, is when it says it slows it down, I don't want people to think that causes constipation, because it doesn't cause constipation, because it still has like a bulking sort of aspect, so it kind of keeps things moving. But just relative to the insoluble fiber, which does tend to sort of speed things up. So when people are constipated, we want to sort of lean a little bit toward the insoluble fiber. And the insoluble fiber just means that it doesn't dissolve in water. So it doesn't turn into that gel-like substance. And things that are really high in insoluble fiber are things like leafy greens. Again, nuts and seeds have a lot of, they have both kinds. And fruits like pears and apples also have some insoluble fiber in them. And then just a little note there that you can see that there's a lot of crossover on these lists. So unless we're doing a fiber supplement, we can't really say it's like only soluble or insoluble fibers. So basically, the take home there is not that you really need to know the difference between the two, but that mostly if you're using fiber to try to lower cholesterol, we definitely want to lean towards that soluble fiber. And also if you're wanting to sort of treat constipation, you want to lean a little bit more towards the insoluble fiber. And then another sort of, distinction that we make in terms of fibers is fermentable versus non-fermentable fibers. So fermentable fibers are the ones that the bacteria actually eat. So they actually break them down and then ingest them, and then they use them to make things like the short chain fatty acids and everything that we've talked about that are really beneficial that the bacteria make. And so fermentable fibers are the ones that do cause more trouble for people with IBS sometimes, and can cause a little bit more gas, because basically the bacteria eat them and then create gases. And I always think of that as being the bacteria party, is oh boy, here's some more gas. And they just sort of, that's the general effect of those fermentable fibers. And also often if we increase the fermentable fibers, again, very gradually, people often tolerate them well, and they're very important as a part of our diet, because of the fact that we benefit so much from the bacteria eating fermentable fibers and then producing the metabolites that we need and that really support us. Yeah, and really, again, we don't have to lean too much. What will happen is, if you're reading about a fiber supplement that someone's trying to sell, they're going to be like, this is the kind of fiber that you need, and this is why it's so great, and this is why it's so helpful. And really, what they're often talking about is all of the benefits of fiber, and it's not necessarily just that one kind of fiber that gives people that benefit. I'm going to talk about a few different types of fiber supplements here, but I think that really, again, that sort of leaning towards getting fiber from food is far superior to getting a fiber supplement. Any questions about that?
Yes, just how do you get fermentable fibers? Like what type of foods would, like you gave examples of the others. So how would you get?
Oh, right. So yes, fermentable fibers are pretty much almost all of the food-based fibers. There's the things you would actually eat. So a lot of the non-fermentable fibers are things that like people take as fiber supplements and things, but like, all of the apples, pears, beans, those are all fermentable fibers. Okay. And so, yeah, I think in terms of like what's the what are non-fermentable fibers, some of them are like a synthetic, actually, like kind of produced fibers, and then also some of them are like those really hard to digest, pieces of like what are actually, I'm really sorry. I'm trying to think about examples of non-fermentable fibers, and it's like, let me see what, I actually want to like make sure I'm saying this correctly, because okay, yep. So some of the harder to digest things like the husks and things like that. That's why, so psyllium husk is an interesting one because it's a soluble fiber, but it's a non-fermentable fiber. Yeah. So what I'm saying about those pieces of things, like really like you must think about like the corn, the little like, when you eat popcorn and those little like holes, like that kind of thing is often like a non-fermentable fiber. And so same thing with like the psyllium husk that often we do as a supplement. And what's nice about psyllium husk is it's a way to get people the soluble fiber and some of the insoluble fiber. So soluble meaning it's water, holds water. But so it helps with the cholesterol, but for people who kind of tend to be gassy, like, so say someone has IBS and they also have high cholesterol and we want to treat the cholesterol with something that is, a fiber supplement. Psyllium husk is a great way to go because it's not a fermentable. The bacteria don't eat it that much. But it also means we don't get that benefit of it, right? So, so it's kind of both are present there. And in terms of other non-fermentable fibers, so many of the plant-based ones really are fermentable. That it's more of like those really hard to digest sort of outer hulls that are really the fermentable or non-fermentable ones. Sorry, but most of the fibers that we think about are fermentable. Yeah, thank you for that one. It's so funny. It's like, that's why questions are so important, is because I'm like, oh, right, I don't even actually know, like some of these things I'm like, oh yeah, I think about, fibers and fermentation and everything else. And then it's like, oh wait, what are the ones that are not fermentable? Well, I don't know, actually. Yeah. Yeah. So fiber supplements, we have, inulin is a big one. So you'll see that one gets added to a lot of things. So if you get like any of like the fiber foods, that are specifically made with lots of fiber. So like the fiber 1 bars or the fiber, yogurt. Some people have a fiber yogurt kind of thing. So this is a great form of it's a fermentable fiber. And it's a great form of fiber. I will say though, that for a lot of people, it makes them gassy, and because it's so fermentable. So the place that inulin comes from the most is chicory root, but it also comes from like Jerusalem artichokes is another place, which we always used to call fartichokes because they had that effect. They're really good. They taste like potatoes and they're really good for you, but they definitely have a side effect because I guess because we just eat more of them than normally would of these kinds of things. I've also seen it being an additive in a lot of different things, so like when they're trying to make something that's like lower calorie, a lot of times they'll add inulin to give it more substance, but then at the same time, not add calories. And so, they're adding it. I had this sorbet, it's like a honeydew sorbet, which actually was kind of amazing. And it had a ton of inulin. I think it had like 13 grams or 14 grams of fiber per serving of this honeydew sorbet. I mean, it's a good source of that. And so actually the other thing too is here I'm using the term prebiotic when I write the little paragraph about inulin, and prebiotic and fermentable fiber can be used interchangeably, because prebiotic is the same thing as a fermentable fiber in the sense that it feeds the good bacteria, or feeds bacteria, so the bacteria eat it and break it down. It's also a great egg substitute. If you're avoiding eggs, you can use a little bit of inulin and mix it with water, and then it emulsifies things so that in place of an egg, because that's really a lot of times the purpose of an egg in a recipe is to be an emulsifier, which means it kind of keeps things in solution. So yeah, inulin is fantastic. It's a great source of fiber. It's also really part of a plan if people have had to be on antibiotics for years and we're trying to rebuild their GI flora. Inulin is a great way to really feed that flora, and it's really a good food for gut bacteria. Flax seeds are something that I use quite a bit as a supplemental fiber. They've been shown to decrease cholesterol as well on their own. They also contain the lignans that trigger mucus secretion in the colon. So they also have a little bit of a laxative effect in that way as well. And they definitely do lower LDL cholesterol. The therapeutic dose for lowering LDL cholesterol is 2 tablespoons a day, but again, kind of working up to that. So I don't ever want somebody to just sort of jump into 2 tablespoons a day, because often they'll be calling me. I'm not feeling so good. So even if you already eat a lot of fiber, actually, even then adding a lot of flax seeds all at once can really cause some trouble. So you're usually starting with like a half a tablespoon, and then working up, adding an extra half a tablespoon every 3 days is a good way to kind of introduce flax seeds there. Beta glucans are interesting because they also really support the immune system. So there's some studies about them having some anti-cancer effects and stimulating immune cells, specifically these natural killer cells that are a part of our immune system that is more global and not so specific to certain conditions or certain infections and things. And so beta glucans are great in multiple ways. They're really high. They're related to like yeast and funguses. Often beta glucans are it's like the cell wall of a lot of different things. So they're also prebiotics, so they feed our good bacteria, and they don't really have as much of a laxative effect. So they're good for people who kind of might tend towards looser stools or frequent stools. And again, if you're eating lots of plant foods, you're getting lots of beta glucans. So yeah, you don't have to take that as a supplement to get that benefit. Beta glucans are high in like mushrooms and things like that too. So that's a great way if you really kind of see that, if you kind of zero in on that immune stimulating property and anti-cancer effect, if you want to get that, really incorporating mushrooms into your everyday diet is a great way to get more beta glucans. Polydextrose and polyols, they're really like, manufactured. They are often, I wanted to add those here because a lot of people are like, oh, it's not like a fiber supplement you would see out there in the world, like that you could buy on the shelf, but it is something that is added a lot to cafeteria food, which is part of why a lot of times when people go off to college or when they start eating at the cafeteria where they work, they can sometimes have some digestive upset because a lot of these are added to kind of maintain the texture of food and the moisture of food, or even like sometimes even like the look of the food, like there's a lot of ways that they're used in different things, everything from baked goods to prepared meals that are really designed to be sort of available over a long period of time, because it's pretty hard to have food look good after it's been out for an hour. So that's where those polyols come in. And if someone does go to, say that they move into a retirement community where they're eating at a cafeteria, or they're moved into a college situation or anywhere where they're eating from a cafeteria a lot and then they have the digestive upset, really the ways to kind of stay away from getting as much of the polyols is to actually stay away, to eat more from the salad bar and a little bit more from, the more, protein based things, and then the salads and the things that aren't really like the pre-made puddings and the baked goods and things like that. That's where you get a lot of those polyols. And for some people it's very helpful because they have come to a new situation. They're like, say they're moving into this retirement community or into college, and people do tend to get constipated when they have major changes like that. So in some ways it's actually for a lot of people very helpful that these are present, because it keeps them regular as they're making that transition there. And then pectin. Pectin is one. There's a lot of people out there who use modified citrus pectin as a cancer preventative or cancer treatment. It's the data is not great on that. I think that there might still be some to come out, and some in my mind the jury is still out on that. I definitely would not. There's nothing in natural medicine that I would recommend in place of the medications that are available now for treating cancer and for preventing cancer. And I always say that, like really, the cancer medications that we have now are much better than they used to be, but they're still pretty barbaric. And also it's the best thing we have because back before those medications existed, cancer was had a much higher mortality rate than it does now. And thanks to those medications, people are able to live longer. And also, people often see those medications, they're like, I don't want to get near them, and totally understand that. And also I know that they have the best chance of a positive outcome. I wish there was something in natural medicine that was more anti-cancer and that really could treat cancer. But I always think about how, cancer is really exuberant growth. And so natural medicine doesn't really have something that has, as much effect, to stop exuberant growth from happening. There's a lot of things we can do natural medicine wise to prevent recurrence of cancer and, in terms of antioxidants and things like that. But once it's there, so anyway, all that to say, the citrus pectin, I don't recommend that as an alternative to other treatments for cancer. And there isn't the research is not fantastic. However, if someone is in remission and wants to prevent cancer, it might be, I don't think it's going to hurt as an addition. For some people, it does cause really pretty severe diarrhea. So that is the way that it could potentially be a little bit tough on the system. What's nice about pectins is that they're actually they feed the good bacteria, and then they actually have an antibacterial effect on some of the bacteria we don't want to have around as much, like the Clostridium, which is like C. difficile. If you're familiar with that, is that a common infection that can happen after antibiotic use and can get very serious, including being life-threatening. And even when it's not life-threatening, it's hard to recover from. So it has a little bit of anti-Clostridium effect, which I wonder if that's part of why when we talk about the brat diet, the bananas, rice, applesauce, and toast, whether or not applesauce, that's part of why applesauce has made it to that list, is because it does do a good job of balancing both the feeding the good bacteria and getting rid of some of the bad bacteria. So it also gets rid of some of the Bacteroides species. So definitely, there are pectin supplements out there. I will say, some people do have a pectin allergy. So, if you're a person that's noticed that whenever you eat a jam or a jelly that you feel kind of like a scratchy throat or you don't feel well, I would not recommend doing a pectin supplement or really kind of focusing on that. For some people, that's where they, when people have like oral allergy syndrome, like, where they can't eat tree fruits and things like that, sometimes that is a pectin response. So just kind of being aware of that is that if you have any of those things like the oral allergy syndrome, or you have, which is where you get really itchy mouth and throat after eating fruits, you definitely wouldn't want to go with a pectin supplement, just in case that's a pectin allergy. So, because that would not go well. So yeah, so that's pretty much everything that you know to know about fibers. And you know, I think basically if you're going to take home anything from this, it's just like yet another reason why it's great to eat more fruits and vegetables and nuts and seeds. And really reminds us of a whole other aspect, you know, that's kind of for us non-nutritional, but it's, you know, for our bacteria it is, you know, really it's kind of one of the many components of fruits and vegetables and nuts and seeds that benefit our well-being. So yeah, any general questions or?
Just a question about mushrooms. What type of mushrooms are better than others? All right. So what do you recommend?
Yep. So like the shiitake mushrooms are actually really good for immune support. You know, they're a little bit stronger for that. The studies about colorectal cancer prevention actually have, and I think prostate cancer as well. Actually, good old white button mushrooms seem to be really effective for prevention there. But in general, kind of in terms of immune support, you know, like if I'm ever making somebody like a, you know, immune supportive soup, I definitely throw some shiitake mushrooms in there. And those do have a lot of the beta glucans in them. Yeah, so, and portobellos and you know, pretty much all of them are good in their own ways, but in terms of the ones you can generally find in the grocery store, shiitakes are really the best for immune support. But the white button mushrooms are nice because they can get incorporated into meals quite easily. I actually use them as a meat extender. So if you're, you know, using a ground meat and then you get a little box of the white button mushrooms and kind of chop them up, it actually can feel like you have more meat in the dish than you do. And even people who don't like mushrooms seem to tolerate it okay as long as they're chopped up really tiny. So that's a little trick there. But but really every kind of mushroom is actually good for getting some beta glucans because it's all about the cell wall of the mushroom cells.
All right, great, thank you.
Absolutely. Yeah, there's more and more research about mushrooms and anti-cancer effects and immune supportive effects, and very specifically, they seem to address parts of the immune system that are have been depleted, and so it's, you know, for most people, like the ways that our immune systems have shifted, and yeah, and those good old mushrooms are really good for us. Very nutritious.
Almost as good as blueberries, right?
Almost as good, right? Yeah, totally. Definitely not. They don't make it into every talk. They just, probably like 50%, right?
Right.
Yeah. I love it. Oh, wonderful. Any other thoughts or questions? No. All right. Wonderful. So I'm going to go ahead and stop the recording, and let's see.